Welcome, everyone. My name is Susan Allan, and I am so thrilled to have you with us today for our special monthly Zoom event all about Lifewave patches. And today we have a really wonderful, wonderful guest who is such a joy. I think you will particularly be thrilled to hear everything he has to say. And his name is Dr. Ray Pevey. He is a chiropractor who is the founder of Arcadia Chiropractic Center. That's in Southern California. He's been a chiropractor for 38 years. And he is so excited by the results he's seeing. In addition to his chiropractic work, he's seeing so much with the Lifewave patches. And he's a specialist in a number of different aspects of healing. He's really well known for the results he's produced in eliminating the symptoms of neuropathy. He's worked with a lot of professional and elite athletes, including with a Major League Baseball team. And he also specializes in corporate wellness and safety. Welcome, Ray.
Thank you, Susan. It's just a pleasure to be here with you today.
So excited to hear everything you're going to tell us. And Marcy, as always, I am so thrilled and grateful to have Marci Preble with us. Marcy is the most successful Lifewave distributor that there is. And she is also the sweetest and most loving and supportive person you could ever know. Welcome, Marcy.
Hi, Susan. I'm so glad to be here today. It's an honor to be with you and Dr. Ray Pevey. He is a very well-known chiropractor in Southern California and very dear to me. So I'm just honored that he decided to say yes to speak with us today, really.
Oh, thank you very much, Marcy. I appreciate that.
And not only did he say yes to appearing on our show, he said yes to Lifewave. So that's what is really thrilling, that you were able to see, Ray, the possibility for you as a doctor, the possibility for your patients. And the first thing I'd love to have you talk about is your own shoulder injury and the healing that was enhanced with the Lifewave patches.
Well, thank you, Susan. I'd love to talk about that. You know, shoulders are pretty important as chiropractic doctors. We use them all day long. So unfortunately, when I injured my shoulder, I tore a rotator cuff tendon trying to do something very positive for myself, which was working out. And unfortunately, I was left with a dilemma. I needed surgery, but I also needed to get back in the office as quickly as possible. So in preparation for that surgery, I was using the patches as a means to expedite the healing and recovery process and the success of the surgery itself. So fast forward, typically for men and women my age, I'm 63 years of age, usually the timeline is anywhere between 8 to 12 weeks to get back in the office to successfully start doing minimal tasks. But with using the patches about a month before the surgery, I was able to expedite that to where I was back in the office in about 6 weeks. And I was back to full activity with my shoulder within a period of about 8.5 to 9 weeks. So I really attribute the success of that to the Lifewave patches and the way that it institutes the stem cell activity and the inflammation reduction. So I couldn't be happier. And of course, my orthopedic surgeon was pretty surprised that I had recovered as quickly as I had. So I attribute that to a lot of the success of the patches.
Fantastic. And that's really a fast recovery from such a difficult surgery, as I know from various people who've had to go through it before Lifewave was something that I knew about. And I'd love you also, Ray, to tell us about how the Lifewave patches made a difference in terms of collagen, in terms of eliminating scar tissue, and of course, something that's really important, particularly to older men, is the question of blood flow. We'd love to hear about that.
Well, when we talk about collagen is a very important substrate in our bodies. It's used in our ligaments, tendons, cartilage. It really binds us together essentially. But in the case of a surgery or chronic injuries, you build up some collagen-like materials, basically scar tissue. And this is not very good tissue. This is the body's way of trying to mend a broken fence the best it can. Unfortunately, it's not as good as the real stuff, which is the collagen. So with Lifewave patches, the ability for the stem cells to go in and do repair at the same time breaking down and eliminating scar tissue is quite profound. And that's why with my patients, I see exponential increase in their range of motion, especially with folks that have had chronic degenerative conditions, joint problems, limited motion. This innate ability for that stem cell activity to reduce that type of scar tissue is quite profound. As far as inflammation goes, there's no question inflammation reduction is quite profound with the patches as well, and that helps to improve healing and recovery, and especially with the fact that a lot of diseases are bound around a inflammation type background. So I couldn't agree more. It's just been a real nice find for me to utilize these in my practice.
I know for myself, and Marcy, of course, you do as well, that just having the Eon patches eliminated excruciating pain for me, and excruciating less than that, maybe, mid-range pain and less pain or whatever. I've had a lot of different things go on, and, since June of 2020, because I swim 80 laps a day, and I would never be able to do any of that without Lifewave. And Marcy, I'm sure you have amazing stories. Maybe tell us one.
Well, I would say that the X39, because it has the unique ability to activate your own stem cells. And when you activate your own stem cells, those stem cells have the unique ability. They're the only cell in your body that are changeable, which means they can turn into whatever cell your body needs for repair. For me, I'm a breast cancer survivor, and I'm really interested in staying in remission. So for me, those stem cells are turning into cells that are the fighter cells to go after those fast growing cells. And, I'm happy to say I've been in remission now for 8 months. And to say that's life-changing, and I don't even know what to say other than I'm just so happy to be alive, to be honest with you. Yeah.
And I know for me, because I'm a lot older than you, it's about prevention too, So if anybody has a condition, it's about healing it. If everybody else is perfectly healthy, it's about preventing things from happening, right? All of the above. And I know, Ray, that one of your specialties for which you're really, really well known is eliminating neuropathy, which is so miserable and disabling for people. And it can be caused various different reasons. And one of them is post-chemo. So talk to us about how you've been so successful, and adding the Lifewave patches has made a big difference with this.
Well, great. I'd love to talk about that. So neuropathy, peripheral neuropathy, has been a real big game changer as far as eliminating lifestyle abilities for individuals. It's basically a condition where you lose touch with how your body sees the environment around you. You have numbness, you have tingling, burning pain, balance problems. Most of the folks that I see with these conditions are in the 60 to 65 year and older category, although I think what we're seeing now with diabetes becoming more prevalent, which is the #1 cause of neuropathy, we're seeing actually younger folks coming in with peripheral neuropathy. I've seen as young as late 30s. And so it's not really privy to only the elderly or senior group. If you do not take care of yourself properly, you can develop diabetes at a young age. As far as what I've seen with the Lifewave patches as part of the protocol with my neuropathy treatment, I have seen an accelerated rate of recovery with the neuropathy treatment. Now, of course, the Lifewave patches, I wish I had known about this a long time ago, because I've been treating neuropathy very successfully now for about 8.5, 9 years. But I've only been with the Lifewave patches now for the better part of about maybe 8 to 10 months. So now has been just a wonderful addition to that protocol of having these successful recoveries in neuropathy. And neuropathy, of course, is something that we always have to be in control of. You never really fully eliminate it in most cases, but there have been some cases where we've had complete remission of neuropathy. So we're really excited about what it has in store for us from this point forward.
Thank you. That is really so exciting. And I'm thrilled to know this. I did not know this specifically, though I remember now hearing David Schmidt speak about this, once and making a note, but there are so many amazing results from these patches. It's really hard, even if you look on the Telegram app and look at the different solutions, it's hard to keep them all in one's mind. So Marcy, tell us about the primary patch that every single human being really could benefit from using, which is the X39. Tell us about
I would love to. This is the X39, and it is the stem cell activation patch. And I would like to talk about this as well as Eon and IceWave, because I really believe that's the pain and repair protocol. And my guess, those are some of the big patches doctor is using in clinic. So I'll just give you the three real quick. So X39 is basically, it looks like a Band-Aid, but it's so much more. When you open it up, inside you will see a white crystal. That is a crystal lattice made up of amino acids, sugar, salts, and water. And it turns out that our body reflects a low-grade infrared light, just like the sun. And we all know that when you go out in the sun, you elevate vitamin D. So when you put this patch on your skin, it reflects back a light wave. The actual name of it is photobiomodulation, using light or wearable light to make something happen to your body. What is happening with X39 is you are activating a peptide called GHK copper peptide. And that peptide is pretty amazing. And you can go research GHK copper peptide by going to reverse aging with GHK.com. And when you look at GHK, you'll see one of the things it does is it acts as a telephone to your stem cells. It tells your stem cells to start marching again, start making more of you again, and start resetting yourself, your stem cells back to a younger, healthier state. And the Army says, yeah, I'm ready to go to work. And why that's important, Susan, is because at age 30, you've lost 50% of your stem cells. And by age 60, you've lost almost all. And I was hearing Dr. Pevey saying his patients are basically with the neuropathy somewhere between 60 and 65, but as low as 30. And it makes sense. Their army stopped marching. Dr. Pevey started putting X39 on their body through light, photobiomodulation. That army is moving again. And what's unique, Susan, is those stem cells are turning into the cells, because they're the only cell in the body that's changeable, to turn into the cell needed to repair. So I like to think probably that army is going to those neuropathy areas and starting to repair, turning into collagen, reducing scar tissue, working on the nervous system, because that is what stem cells do. So that's X39. Eon reduces inflammation. And I believe Dr. Ray Pevey said that inflammation is at the root of many disease processes. So if you can reduce inflammation, you're way ahead of the game. And it looks just like an X39. It looks like another Band-Aid, but it says Eon on the back. And really, inflammation is an eater of stem cells. So I like to say these are the repair and regeneration patches of the line. And when you reduce inflammation, you make the stem cell patch work even better, turbocharge that patch, because think about it. X39 is getting your stem cells working again. Eon stops inflammation. So those X39 stem cells get to work even harder. And last but not least, I know doctor uses a patch called Icewave. Icewave is the pain patch. Pain is in the connective tissue. My guess, many of his patients with neuropathy, the nerves aren't working correctly. They're in a lot of pain. So I know that doctor most likely pops that pain spot, brown on the pain spot, white 3 inches away, is going to break the connection of pain right where the pain is. He'll have to tell you, but my guess is the X39 or an Eon are either going right below the back of the neck or under the belly button. And right there, Icewave's going to break the pain while X39 and Eon do the repair. What we find is that repair usually happens within 30 to 60 days, and you don't even need Icewave anymore. But Icewave is that pain band-aid until the repair happens. So those 3 patches, I know many chiropractors, as Dr. Ray Pevey, are using as their pain and repair protocol.
Exactly. Thank you so much. You know, I learned something new from you, Marcy, every single time we speak and every single time you do a Zoom. So today it was photobiomodulation. So say that fast, right?
Right.
Photobiomodulation. And when people ask about the Icewave, the fact that the pain is in the connective tissue is a really, really valuable phrase for me. And I'm so grateful to hear it, because people tend to think that their pain is in their body part, the elbow, the knee, the ankle, the joint normally, right? No, the pain is in the connective tissue. And so thank you so much for teaching us, that today. It was really beautiful.
You're welcome.
So Ray, the next thing we want to hear about is, because you told me that one of the key benefits of the Lifewave patches for your patients is how they're able to regain their lifestyle. So would you talk about that for us, please?
Oh, I'd love to. So one of the things, of course, when I sit down and do a consultation with a patient, I like to ask them, because of why you're here, because of the pain you're in, what is it you're missing out on? What have you started to lose, or what have you lost as a result of what you're going through? And many a times it's things that a lot of us take for granted. It could be going for a walk in the park. It could be playing with their grandkids. It could be going out golfing. So lifestyle for me is helping a patient regain that lifestyle through a number of different tools in the toolbox. Chiropractic being a foundation for me, of course, but this wonderful addition to that tool in the toolbox, the Lifewave patches, has been instrumental in kickstarting the progressive recovery that chiropractic has been so good to me to be able to do. So typically when a patient is put on Lifewave patches, as Marcy had mentioned, I do put them on a protocol of X39. I also use the Eon patch as well as the Icewave. Typically, the pain level we're working to try to eliminate initially. That's not our only goal, that's our first goal. And then we move into supportive, which is continuing with the X39 and the Eon patches for the next 2 months. And then we move into more of a supportive role after that, usually staying with the X39 so we can keep stem cell activity at an optimum level. So that is the formula I'm using currently, and what I've also discussed with my colleagues as a means of helping patients to regain their lifestyle as fast and as effectively as possible.
Thank you. And I have to tell you that the X49, the addition of that, in terms of regaining my lifestyle, wait till you hear this one. So I was always swimming 80 laps a day, and then the pool went through reconstruction, which took twice as long as expected. So I didn't swim for almost 4 months. And I don't like other exercises. And I certainly didn't want to start doing things that were going to, impact my joints. So I just waited. And it took me only 4 days to get from 40 laps the first day I got back in the pool to my normal 80 laps. That is unbelievable. Because just last night, I spoke to a very, very successful athlete who was actually at an Olympic training camp some years ago. He's a really skilled athlete, and he was stunned. And I said, well, believe me, I wouldn't have been able to do it without the Lifewave patches. So that, of course, was my introduction to talking about them. But Marcy, tell everybody about the X49 in case everyone isn't already wearing them.
Well, I have to say, X49 is super special. And once again, it looks just like a Band-Aid. But it's X49 because it says so on the back. X49, like X39, are both stem cell activation patches. So they're the only stem cell patches in the line. X39 is about regeneration and repair, about actually turning into the cell you need for repair, right? Regeneration, repair, age reversal. That's X39 and is activated with GHK copper peptide. X49 is the daughter peptide of GHK called AHK. And let me tell you, the daughter is as powerful as the mama, as we women all know, correct? And so let's talk about what the X49 does. X49 is all about sculpting the physical body. What do I mean by that? Well, it cuts fat by 10% in 30 days. Who doesn't want that? It builds lean muscle mass. It increases grip strength. So all about the physical. I hear it does wonders for men over 50, if you know what I mean. All about sculpting the physical body, okay? But there's more. X49 also does some amazing things. It supports organs, your brain, your heart, blood pressure. It grows bones. What woman over 50 doesn't need bone support? And it protects us from 5G radiation from our phones. The owner, inventor, and CEO of our company, David Schmidt, was looking for a way to protect us from 5G, to put something on our phones. 5G is too powerful. It doesn't work. But he found that daughter peptide, AHK, protects us from 5G internally. So pretty amazing. So I like to say X39, stem cell activation, regeneration, repair, even age reversal. X49, just going to make your body hot and do a whole lot more. Okay, so of course you need them both.
Well, I know I do.
Right.
Thank you so much. So Ray's going to speak next about breathing. And I just want to remind those of you who don't know me that I'm only swimming 80 laps because of the improvements to my lung capacity. I suffered with asthma for decades. So I'm only able to do this because of the stem cell patches. And the fact that I don't have to stop is a complete miracle that is literally, since I had been using the X39 and the Eon for a while, that's the first thing I noticed. And of course, it just gets better and better. So Ray, please tell us just what you've seen with a few of your patients who have improvements in breathing.
Well, I've had a lot of success in my career with working with patients with asthma conditions through chiropractic. What I feel the success that I'm also achieving from the use of the patches is that we have that unique inflammatory reduction that the Eon patch provides, coupled with stem cell activation from X39. So you can go in there and do repair in the bronchioles of the lungs, the lung tissue, conditions like COPD, emphysema, exercise-induced asthma. These are all gaining benefit from the use of the patches. And I just think it's just a phenomenal thing that you can do to take, especially a small child, off of a ventilator. like a intubation type of ventilator where they're using, steroid medications and things. So to be able to do that is life-changing for not just that young child, but also for the parents and not having to see their child use these medications. So without question, breathing capacity can be helped in most cases, especially if the patches are used appropriately and consistently. So my hat's off to the use of that type of activity.
There's a young man in my downline who lives in Florida with cystic fibrosis, and the X39 and the Eon has made such a remarkable difference in his life that his mother was no longer having to aspirate his lungs every 15 minutes, day and night. Day and night. So neither of them had a proper, forget night sleep, we're talking about a proper hour's sleep. And the story that I was told by the dad that was so astonishing to me is that the nurse practitioner who would be on the phone with them, one day she was on the phone and she said, where's your son? And the dad said, well, he's right there. He's over there in the bed. And she said, no, but I can't hear him breathing. Where is he? This was the first time the nurse practitioner had ever done a check-in call with the family and not literally heard this young man breathing from across the room. That is a miraculous, astounding kind of thing. The entire family's life is forever changed, So we are so thrilled with every story that each one of you tell us, and every single one of you who posts something on Telegram is making such a difference in everybody's life, So Ray, maybe tell us now about the immune system and what you've seen with your patients.
Well, of course, through these times now, the immune system has become a very popular subject to talk about with COVID and the infection rates and things. And I can tell you right now, obviously my entire practice isn't using Lifewave patches yet, although that's my goal. But a number of patients that are using the patches, some have had issues with maybe a family member who has contracted COVID, and they may, by some unfortunate situation, contract it themselves. But the reaction to the COVID infection has been extremely minimal and very mute for the most part. I really believe that the accentuation of the immune system by the patches has really been very, very helpful, especially in the elderly population. So we've been very fortunate that in our practice, we haven't had anybody have any major issues with COVID. And I really feel that the patches and of course, the combination of the chiropractic care has been extremely instrumental in helping that immune system boost.
Thank you. And I would say that of all the people I know in the Lifewave universe, I don't know anyone who's gotten COVID. Some people have vaccinations, some people don't. And I don't know a single person, or I don't even know of a single person who's gotten COVID. So there's no question. And of course, I am so grateful for my immune system. And Marcy, as we know, you're getting healthier and healthier every second, right?
Well, I would say as it relates to viral load and immune system, maybe I'll just explain a couple patches that would help boost immune system as Dr. Ray is talking about immune system. And of course, we've already talked about X39, which is stem cell repair, Eon to stop inflammation, of course, but there's two other patches that are quite amazing for immune system. The next one is called Glutathione. And glutathione is your master antioxidant in your body and your master detoxification. So when you take glutathione or put the patch on, once again, it's a patch that says glutathione, it activates your own glutathione. Glutathione is the puller of all yuck, virus, fungus, mold, toxins, metals, You name it, it's going to pull it out of your body through your skin or through your waste. And you're going to detox that out. And let me tell you, immune systems, the main issue with immune systems is something called free radical damage. And free radical damage happens from the food you eat, the water you drink. I would say if you ask Dr. Pevey, he would say just combusting your own energy, the exhaust of your body is free radicals. And they are what destroy the cells of your body. Glutathione is like the master antioxidant regulator. As an example, we all know we're supposed to take vitamin C, and that goes after free radicals 1-to-1. Glutathione, upregulating that in your own body, that system, is like going after free radicals 1,000,000 per second every second, like a fire hose putting out the free radicals in your system. So it's like having a fire hose boosting that immune system. So no, glutathione is really, really going to help power your immune system to be strong. So I like to say the immune system buster in this protocol would be X39 Eon and glutathione. And my guess, Dr. Ray probably is providing glutathione to some of his immune compromised patients, would be my guess.
And Ray, would you like to say something about either glutathione, which is a incredibly powerful detox? And by the way, Marcy, as you know, I've been studying superoxide dismutase since 1994. That's what the Eon patch is. And that is the other master detoxifier. So every single day, 12 hours a day, I'm wearing the Eon and a glutathione.
You know, it's funny, Susan, the SOD is very important. SOD, superoxide dismutase, is the other master antioxidant. So really, you know, I was talking Eon for inflammation, but it also goes after free radicals. No wonder we feel so good on X39 Eon and glutathione.
And I was going to say too about glutathione. A lot of patients will try to supplement that. And unfortunately, glutathione gets denatured in the gut because of the acidity in the gut. So it's really not as effective a tool as we'd like it to be. But the beauty of glutathione produced from the inside, we get the full benefit of that, magnified many times over. So it's just a wonderful addition for, as Marcy mentioned, for immune system upgrade. And you get the full benefit of the use of that glutathione by the fact that it's made internally, not externally being brought in.
You know what, Dr. Ray, it's interesting you say that. I was talking to another clinician and I was talking about glutathione, and I said, well, glutathione, because of photobiomodulation, through the light, activates your glutathione for 12 hours. And my friend who's a clinician said, well, that's good because the IV glutathione that everybody's doing has a 7-minute half-life. I was like, huh. So yeah, that's really quite different. And that's why, at least when I started glutathione, I have bacterial issues, and it pulled it all up my nervous system, Ray, which of course makes sense. Toxins live in your nervous system, I believe, on your nerves. And you might want to tell me if I'm right on this, but I think it pushed it up my nerves and out my back. Like there it was. And now I'm fine. I have no acne on my back anymore, but I'm pretty sure glutathione was doing its job.
I would agree with you on that, Marcy. I mean, you know, if you're not eliminating properly, you're going to become extremely toxic. So the skin is a pretty good, observational area for finding out how toxic you are, depending on what's coming through your skin. So that is a big plus with the glutathione to help with expediting the removal of toxins. One thing I do want to say real quick, Marcy, when Marcy first told me about Lifewave patches and how it worked, it really clicked for me, as it will probably click for a lot of my colleagues who use neuropathy treatment in their office. And that is the neuropathy treatment we use is based on phototherapy. So the correlation really had a pretty good sticking point in my mind as far as, well, phototherapy, neuropathy treatment, phototherapy, Lifewave patches, and stem cell activation. I mean, the body is this beautiful, house that we live in, and the light energy that it emits, the photo emissions, if we harness that properly, which is what Lifewave patches do, the benefits are just astronomical. So it really drove me to go into this type of therapy just by virtue of I was already doing something that was working, but why not add something else that can make it work even better?
Wow, doctor, I do want to understand that. So in your neuropathy treatments, you use forms of light therapy. Maybe you could explain that a little more. And so it was easy for you to see that light does treat. And so that wearable light would also ramp that up. Will you explain that a little more? It's fascinating.
So we use in the office infrared light, which is, guess what's being made from the patches? It's an infrared signal back into the body in the form of activation of stem cell activity. So infrared light in the form of near and far wave infrared light, not the kind of infrared light that you warm your food up with. It's totally, there's no temperature, but this stimulates activity in the body to help with blood flow. So, the Lifewave patches alongside with it was, once I started understanding it and was able to see the mechanisms of how it works, it just made total sense that it would be an amazing coupling, if not at the very least accelerating of the recovery for these patients with severe neuropathy. And I've actually, to take it one step further, I've actually upgraded the level of severity that I'm willing to take as a patient in neuropathy, because coupling it with the Lifewave patches has been so successful. I feel very confident now that even the more severe cases can be helped when we use those two disciplines together.
Wow. I don't even know what to say.
No, it's pretty amazing stuff. And you and I have had some conversations in the past about, what I'm doing and the protocols I'm using. And it's been just it's been a very pleasant surprise, if not an amazing surprise, to have it be a part of the protocol in the office here. So looking forward to many, many more opportunities to help others.
Wow. Wow.
Okay, so there's so much we could talk about. And of course, you'll have to come back, Ray. But for today, I think there are probably more people who have questions about cholesterol and the issues of people who take statin drugs. If you could explain how Lifewave patches are making a big, big difference in those patients' lives, that'd be great.
Well, it gets back to blood flow. It gets back to creating an environment where blood can flow more favorably, not create stagnicity, almost like what I want to call a thickness like oil in the bloodstream. And the fact that cholesterol is more easily adhering to the blood vessel walls, if the blood flow is not good and consistent, then cholesterol can start to create its own challenges for the health of that individual. Now, statin medications do have a downside in that they can actually promote neuropathy by way of the way that they reduce the cholesterol around the nerve. The nerve gets pitted and is more damaged by the immune system. So if we can get away from statins by improving the blood flow, by the use of diet and of course Lifewave patchwork protocols, then the dependency on medications goes down quite significantly. So it's just a matter of educating and having the patients be all in on understanding it's a team effort, but they have the ability to have an impact on their life if they want to do it.
So I have a question, doctor, based on that. So I know that X39 and X49 help to manage blood pressure, reduce it. Eon as well, because it stops inflammation. Is that what you mean by reducing the blood pressure? It would reduce the cholesterol? Like, I don't understand. How does that work exactly?
No, reducing the blood pressure doesn't necessarily reduce the cholesterol. The way you're going to reduce the cholesterol quite significantly is through dietary management, exercise. But on top of that, you want a medium that allows the blood to flow as readily as possible. In other words, not thinning the blood down, but actually just having a nice consistent flow so that the heart's not working as hard as it has to. The blood pressure doesn't go up because there's so much resistance in the blood vessels. So the Lifewave patches have the ability to expedite a way in which that blood flow can be improved. And that's critical in neuropathy. We've got to get blood flow to the nerves so that the nerves can be regenerated and healed. Now, with the stem cell activation, we have another member to the party here that can help with that same scenario as well. So just to, again, summarize, the blood flow is critical to keep cholesterol from accumulating, stacking, and creating potential blockage. And when that's done, then the cholesterol in the blood can be processed more readily and eliminated. Rather than storing, building. It's almost like a wall in your arteries to the point where now you're going to have a potential clot that could lead to a heart attack, a stroke, a number of different things.
So basically, the patches would help your own body manage the cholesterol correctly so that you're not going to have the layer effect, but you're going to have enough to protect the nerves. So it's really the stem cell activating the stem cells to turn into whatever cell they need to be for your own body to be managing this, so you can reduce some of the medications like the statins, or like if you were having higher blood pressure medications, of course, with your doctor, watching it with your doctor.
Right. And you need cholesterol. I mean, your heart needs cholesterol for energy. It's just that we've all heard that there's a bad cholesterol and there's a good cholesterol. We want the good cholesterol, and having a system that allows adequate blood flow processing, that's where the liver comes into play, where cholesterol is manufactured. That's basically where medications go to. They go to the liver to change the way the liver makes cholesterol. But we just don't want to interfere with that process if we can do things that can be complementary to that situation. And I think that the Lifewave patches have the ability to do that just because they've shown how they improve blood flow and not allow accumulation of cholesterol in the arteries as readily as say a water line that just runs slow and it's not clear, it's just getting dirty, it's just getting built up. We want things to move and keep moving consistently. So there's the benefit with that, having those two coupled together and get away from the actual use of the medications if we can, as early as possible, actually.
Wow. And again, the prevention to me is even the greatest miracle that we offer people when we tell them about this.
Sure.
Now, in the few minutes that we have left, Ray, if you would talk about what you've seen in digestive improvements, because that's another area.
So in digestive improvements, you need blood flow to digest food, and to take the digestive particulates, the things that we all get from food, proteins, carbohydrates, fats, and things, get them to the areas that we need for nourishment. So from a digestive standpoint, if we get back to blood flow, if we have good blood flow, digestion improves. We're able to get digestive enzymes in the right place and get all the good stuff to break down like it's supposed to. And readily, we see things change for things like irritable bowel syndrome, bloating, just feeling very uncomfortable, constipation. All these are things that can improve with better blood flow because you're processing your food more consistently. So that's the bottom line, is blood flow when it comes to digestion.
I just want to remind everybody that this is cumulative benefits that people are seeing. People that I've told about Lifewave patches who are using them, who are in their 70s and 80s, who have suffered for decades with many of the different symptoms we've talked about today, particularly digestion. And they would be astonished, that a week later, a month later, 2 months later, 4 months later, 6 months later, they were seeing these cumulative improvements, literally rolling the clock back so that health that they had not experienced in a very, very long time had returned. And that, Ray, is what you're talking about when you talk about quality of life, returning to that lifestyle. Yes?
That's exactly right. I mean, just to be able to get out of the house and not have to worry about, I have to find a place to sit down because I know I can't stand that long. Or if we want to talk about digestion, there's folks that are always looking for the next restroom just because of their gut is just not really functioning normally. So if we can change those things, there's a whole means of opening up a lifestyle back to that individual and not feeling imprisoned by what their body is causing.
And not to mention all the older women who don't have to have, UTIs anymore. That's one of the amazing things, that I personally discovered with the stem cell patches and the eons. Yes, Marcy, you were going to say something.
Oh, I was just going to ask Doctor for the improvement of blood flow for digestion and also for cholesterol management. I understand that now. What would he recommend the patches be for that improvement? Would it be X39 Eon for sure? Would you add carnosine and X49 to that as well? What would you recommend, Doctor?
I would definitely do X39 and Eon. I like the glutathione on top of that as well. Carnosine, because it has an effect on heart health. It has an effect on brain health, circulatory health. There's no question that would be a benefit. I'm learning more and more about X49 and like you were mentioning earlier, this complementary partner to X39. It would certainly be a great benefit to have that as part of the protocol as well. So if I had to round it out, I would say X39, Eon, X49, carnosine, and glutathione would be a formidable group to really battle and get the maximum overall benefit of circulation and obviously stem cell activity and inflammation reduction.
Wow, thank you.
And if you know anyone who's older, carnosine for the older brain is astonishing. I say this personally. And one of David Schmidt's closest friends is a very good friend of mine. And she happens to be an expert, as you can imagine, in the Lifewave patches and in also supplements. And so we were discussing the fact that carnosine for the older brain, well, it stops it from being an older brain. That's the best thing of all. And that's what the Lifewave patches do. They stop every part of you from being the older, arm, leg, brain, heart, you name it. Okay, so thank you, everyone. And thank you, Dr. Ray Pevey. And thank you, Marci Preble. I'm so grateful to have both of you. And Dr. Ray, you must come back on the show soon. I'll speak to you and we'll get you scheduled. And you'll have lots more experience and lots more grateful patients who are raving about Lifewave by then, right?
Yes, Susan, thank you very much. I really enjoyed being here and sharing with everybody today. Marcy, thank you again for you and just the wonderful friendship we have together as well. And I look forward to being invited again in the very near future.
Marcy, we all love you. Anybody who knows you loves you. So thank you.
Really great being here. I learned a lot today. So thank you.
Yeah, this was a really special show because of our really spectacular special guests. So there are now 25 of our shows, Marcy, already on my YouTube channel. So everyone who's here today, please contact the person who told you about Lifewave, Contact the person who invited you to this show, thank them and ask them questions. And please, if you'd like to know when this show is available on my YouTube channel for all your friends, please subscribe. Go to youtube.com/Susan Allan 2001, and that's Allan is Allan. And our next show is April 14th. They're always the second Thursday. Same time, 1 o'clock Pacific, 4 o'clock Eastern, and various times around the world. And our guest is Juliana Coles, who is a specialist in integrative health and also a very brilliant person who loves Lifewave. So we'll see you all then. And thank you so, so much. Have a wonderful, wonderful day.